my shoulders, you can see Rhode Island. Ho, 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 ho.
A Simpsons appearance by one of New York City's biggest Simpsons fans, a man who admits that his rule of thumb in life, at least politically, is if Mayor Quimby likes it, I don't. Joining us now, the mayor of New York City, Bill de Blasio. Well, how big was that for you?
I was like, that's pretty much the high point of my life.
Right, where do you go from there?
Yeah,
that's the real question.
It's the pinnacle. But Mayor Quimby, just I want to say to all the elected officials out there, I'm going to look at them right now, do not be like Mayor Quimby, okay? You've got your negative role model. Just avoid anything he would do, okay?
Why the ugly partisan attack on Mayor Quimby?
Well, apparently he's a fellow Democrat,
right?
You know? So
right.
I think this is actually quite bipartisan. I don't care what party you're in, don't be like Mayor Quimby.
Well, congratulations, Mr. Mayor. You've arrived, you've made it. You've been on The Simpsons.
Thank you, Willie.
Let's talk.
Except Willie, how can he trash Mayor Quimby? I mean, Quimby is one of the great leaders of our time. I mean, the next thing he's going to be doing is trashing the legal skills of Lionel Hutz, attorney at law.
He wouldn't dare.
Which, by the way, Mr. Mayor, the ethics rules of this state prevent me from promising you a big cash settlement, but just between you and me, I promise you a big cash settlement. Phil Hartman's character, as good as it gets. So that was exciting. You got a line out of it, though, right?
Yeah, Joe, I'm very impressed to see you know the full canon of The Simpsons works. That's very, very erudite of you.
Well, not only the old ones, but also the new ones. My son Jack is a massive Simpsons fan, so it really is shocking that here we are. What? How many years? 30 years later.
Unbelievable.
They just keep going, and you know we'll jump from seeing something in season 4 for the 15th time to going to the 29th or 30th season. It's good, and now they finally arrived. They got you here, so we could keep talking about the Simpsons obviously all day, but let's instead break some news here.
Yep.
And you are about to do something pretty remarkable in New York City. Why don't you tell us about it?
Yeah, Joe, this has never been done before in this country in this kind of comprehensive way. It's going to be for the first time a guarantee of health care. We're going to guarantee health care for New Yorkers who need it. And we have now in New York City something that we can build on. We have a public option that we're ready to make much bigger, a public health insurance option that can reach the hundreds of thousands that are right now not in any kind of health insurance. We also have a way to provide direct health care to a lot of our neighbors who happen to be undocumented. They're still part of our community. They need health care. Their families need health care. We recognized that, obviously, health care is not just in theory a right. We have to make it in practice a right, and we're doing something about that here in this city. And, you know, the national reality, I don't have to say that the Republicans in Washington have been trying to tear down health care, trying to tear down the universality of health care coverage, get rid of Obamacare. We're doing the opposite. We want to increase the amount of health care that people can reach. We want people to have primary care. We want them to have specialty care, maternity care, mental health services, pediatrics, OBGYN. This plan will give all of that directly to the people who don't have it in the city. It's called NYC Care. And it's going to revolutionize the approach, because you know what people are doing now, Joe? They're going to the emergency room. That is the default healthcare provider for so many people in this country. It is the worst way to get healthcare. It's the most expensive way to get healthcare.
And Mr. Mayor, as a fiscal conservative, as a guy who got into public office to balance budgets, so I've been trying to tell my conservative friends for years, that if you think you're denying people health care, you're not. You're just driving single moms and their children to the emergency room at 11:30 at night. It's not only inhumane, but fiscally, it's stupid, because that is expensive, it's unproductive, and it is the worst way to manage costs in a healthcare system.
Exactly. We're already paying an exorbitant amount to provide healthcare the wrong way, and to wait until people are really sick. You know, to wait until seniors are really sick and end up in that emergency room, when what we should be doing is helping them get the primary care. This plan will literally say, here's a primary care doctor. Here's a person you can see is now going to be your doctor on a regular basis. And if you need something else, a specialty service, here's how you get it. We're going to make sure it's seamless, because that way people actually are encouraged to get the health care they need and never get to the point where they end up in the emergency room.
So the need here, Mr. Mayor, as I understand it, is there were about 600,000 New Yorkers who weren't caught even by the Affordable Care Act.
Correct.
They either could not or were not eligible to enroll in that program. So what does this do for them? What could they get sick, and now what happens? How do they pay for it?
Well, let's talk. I'm going to explain that. But first, that 600,000, a lot of them are what they call the young invincibles. And you know what that's all about, Willie. The young folks, some of them are working class, some of them are even middle class, who think they don't need insurance.
Right.
And then, God forbid, they get sick and they find out they really have a problem. We're going to reach out to a lot of them and say, here's an easy way to get health care that we can plug you into. Other folks literally just can't afford the plans that are on the exchange right now. And as I said, there's also folks who are undocumented who can't access the exchange. About 600,000 people. We got another 8 million people who, thank God, do have some form of insurance. This is one universal way to reach all those folks right now who are not covered. And it's straightforward. We say, become a part of this plan. You get a doctor, again, primary doctor, all those specialty services. You know where to go to get the help you need. If you are some of the younger people, for example, who could afford insurance but haven't done it by now, here's going to be an easy, affordable way to do it. If you're someone who can't afford it, we're going to make sure health care is available. It's a sliding scale. People will pay what they can. But the difference here is with NYC Care is, you know, it's universal. You know, we were talking before about universal pre-K, which is something we now have in this city. What parents have said to me is once they knew that pre-K was absolutely going to be there for their kid, they planned their life around it. It changed the way they thought about things. It made life easier, less stressful. Here's a way for everyone to know health care is going to be there for you.
So the estimates are this will cost at least $100 million per year at full scale. You can hear the critics saying, why am I paying for these young invincibles who don't want to buy insurance? Why am I paying for undocumented immigrants at the tab of $100 million? What do you say to them?
Well, I say the famous phrase, you can pay me now or you can pay me later. Just the point that Joe made before. If we don't help people get to health care, we're going to pay plenty on the back end when people get really sick. We're going to have a lot of people going to work sick and making everyone else sick. We want a healthy society in every sense. And here is a way to invest up front to get it right. Imagine a society where everyone knows they have a doctor they can get to. I mean, right now, a lot of people don't go to the doctor because they don't know where to turn or because they literally don't have enough money in their pocket to handle it. We want people to get health care when they need health care. To me, that is the moral choice. And to me, that ultimately is one that's a smart economic choice, too, because we're not doing the crazy thing, which is making the emergency room the first place people go for health care.
So do you have to raise taxes to get this up off the ground?
No, this is something that we're going to pay for through our public health care system because we're making it a priority. We'll put the money in to make it work. It's going to save us money down the line because we're not going to have as many emergency room visits. It's going to save us money because we're going to see people get healthier overall. There's no question. Look, if folks get primary care, or I'll use mental health as an example as well. My wife has led an initiative called Thrive NYC to make mental health care universally available. If people get mental health services when they need them at the right point in life, that means you avoid everything from, God forbid, homelessness or incarceration or people losing their jobs. There are immense savings, humanly and economically, to getting it right.
Really quickly before we go, a lot of New Yorkers watching this show, how do they get access to this website?
They're going to be able to go on the New York City website or call 311, which is our broad service number for New York City government. It's going to be up and running this year. It'll build out over the next few years. NYC Care, but it's literally going to be a phone call away or a click away for people to sign up.
All right. Simpsons star Bill de Blasio, also mayor of New York.
Finally, Willie.
As an afterthought.
No, I want that first title, Simpsons star. I feel really smart.
You worked for it. You've earned it. Mr. de Blasio, Mr. Mayor, thanks for being with us. Always good to see you. Coming up next on Morning Joe, a new test for the president on the international stage after an abrupt resignation. We'll go live to the New York Stock Exchange for more on that. And Morning Joe comes right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.